Hi, my name is Jasmine Vega, and my research proposal is on nursing medication errors. Medication errors are a common issue in nursing that occur to a number of issues. The purpose of this study is to identify what contributing factors are involved in medication errors. Also, it's to aid in future research in formulating a way to reduce medication errors made by nurses. Medication errors are defined as prescription errors, medication delivery errors, and/or administration errors. The independent variable is the amount of medication administration errors that occur in hospitals or nursing facilities. My dependent variables are the age of the nurse, the mental emotional health of the nurse, the kind of nursing facility, the nurse-patient ratio, level of stress the nurse is under, hours of sleep on average prior to each shift, the amount of shifts worked per week by the nurse, and the amount of exercise on average the nurse gets, the nurse's gender, and the highest level of education achieved by the nurse. Theoretical framework. The theoretical framework is based off the phenomena that medication errors occur in hospitals and nursing facilities. My prediction is that medication errors occur in hospitals due to multiple contributing factors rather than to one specific issue. A study done on wrong-time medication errors found that for an overall of 250,213 medications prescribed for 5 different selected inpatient locations, only 18,833 doses were not administered. In a double-blind, peer-reviewed article, a researcher found that 4 main causes of drug errors occur. The first one is interruption and distraction of nurses during drug administration. The second one is insufficient knowledge and lack of nurse education in pharmacy. Third is lack of confidence of student nurses administering medicines. And the fourth is difficulties in performing drug calculations. This will be a quantitative study to provide insight into contributing factors of medication errors that occur in nursing. It's a correlational study due to variables being correlated with medication errors being studied. For the data collection, a survey will be given at nursing facilities and hospitals. This will be a quick and easy method of collecting the wanted information. The sample size will be 150 nurses, and the hospitals will be in areas of economical variances, also in different hospital units, and nursing facilities outside of hospitals, such as private practices and assisted living facilities. Nurses will be given a consent form to be signed, as well as a survey, which will be collected as soon as they are filled out to ensure they are all collected. Data will be broken down into coding, which is the process of reading data and breaking it into subcategories and giving labels to the text. Questions asked will allow the researcher to input them into specific categories for further analysis. After the data is analyzed, it will be presented by a quantitative display of graphs and charts showing statistical findings. Applicability to nursing. Every nurse has the possibility of making a medication error while taking care of patients. This research would contribute to nursing knowledge by showing correlations between various factors and the amount of medication errors that occur in relation to each factor. In conclusion, This would allow for further research to identify factors associated with medication errors, and using that to work on finding a way to reduce the amount of nursing medication errors that occur in nursing facilities. All areas of nursing would greatly benefit to reducing the amount of medication errors occurring by identifying main factors correlated with them. And here are my references. Thank you, and that was my research proposal.